What's up, PT people? Back with another article. This one is titled Pedaling Based Protocol Superior to a 10 Exercise Non-Pedaling Protocol for Post-Operative Rehabilitation After Total Knee Replacement, a Randomized Controlled Trial. Authors of this article are Sattler, Hing, and Vertullo. Background. Despite the routine use of physical therapy in the immediate and early post-operative phase for patients who undergo total knee replacement, there is paucity of research into the optimal exercise protocols in both the acute inpatient setting and early period after discharge. I had to look up the definition of paucity, and that means smallness of number. Back to the background. Pedaling has often been recommended by clinicians after TKA for rehabilitation, but to our knowledge, there has been no investigation into its utility in the acute postoperative setting. Therefore, we performed a randomized controlled trial evaluating the efficacy of pedaling in the acute postoperative period. Methods. 60 total knee replacement patients were randomized to receive postoperative physical therapy involving either a 3-exercise pedaling, which will be called a pedaling based, or a 10 exercise non-pedaling protocol. Outcomes were assessed at 2 days, 2 weeks, and 4 months, and included physical tests of function, patient-reported outcomes, and other post-operative measurements. Before we go on, something I've seen kind of trending in the past few years is shorter and shorter stays in hospitals after orthopedic surgeries. And also, there are times where doctors are referring straight to outpatient physical therapy rather than home PT. So this information can influence how we treat patients in that early period prior to the 2-week timeline where it would normally take for us to see these patients. All right, results. With respect to the primary outcome, the 6-minute walk test, the measured distance was significantly greater in the pedaling-based group than in the multi-exercise group at 2 days postoperatively, with the mean difference being 66 meters. Results of other functional tests, the 10-meter walk test and the timed up and go test, were both significantly superior for the 3-exercise pedaling group at 2 days, as was the patient-reported Oxford knee score. The latter continued to be superior at 2 weeks, as was the EQ-5D score. The visual analog scale component of the EQ-5D was significantly better for pedaling group at all time points assessed. Length of stay was also significantly shorter by a half day for the pedaling-based group, and that's in regards to the hospital stay. The multi-exercise group was not superior for any outcome measure at any point. So that's very telling right there. Conclusions. A pedaling-based protocol in the immediate post-operative period after TKR was superior to a standard multi-exercise protocol in both functional and patient-reported outcomes, with these benefits decreasing over time. This was level 1 in terms of level of evidence, meaning that there's nothing better. Randomized controlled trial. It's the cream of the crop. All right, this is my 5th video of the week, back to back to back to back to back. So I have a request for all of you listeners out there. How long do you put your patients on the bike for, specifically for a total knee replacement? Does it change throughout their time of treatment? Do you have them on for a certain period of time when they're 3 weeks out, and does that change at 7 weeks out? Let me know your thoughts and reasoning behind that. So comment below, subscribe to the channel to keep up to date with all the future videos, and like if you enjoyed the video. See you next time.